Thanks for being here, everyone. Premier Moe will have an opening statement, followed by an opening statement from Dr. Shahab on the second presumptive case of COVID-19 in Saskatchewan. Premier Moe.
Thank you very much, everyone, for coming here today. 2 days ago, the World Health Organization declared the COVID-19 outbreak to be a global pandemic. Yesterday, Saskatchewan's Chief Medical Officer declared the first presumptive case of COVID-19 in Saskatchewan, and today, Saskatchewan's Chief Medical Health Officer has confirmed a second presumptive case of COVID-19 in our province. I know the emergence of this pandemic is creating great uncertainty for families and communities across Saskatchewan. People across this province are wondering what this means for them. Families are worried about the impact that COVID-19 could have on their community and on their family members. And as a father, I most certainly understand this. As a premier, I most certainly understand this. And I can assure you that the entire government of Saskatchewan also understands this. Over the last several weeks, the Ministry of Health, led by the Chief Medical Health Officer, Dr. Shahab, has been coordinating a province-wide effort to prepare Saskatchewan for the arrival of COVID-19. And this provincial effort has also been coordinated with the federal government, the Public Health Agency of Canada, and provincial government, as well as provincial governments and health authorities, again, across the nation. With the arrival of COVID-19 in Saskatchewan, I'd like to express my confidence and the confidence of the government of Saskatchewan in the efforts of Dr. Shahab, in the efforts of public health officials and Saskatchewan's healthcare system. I want to say how grateful I am for the professionalism and the dedication of all of those that are working in the Saskatchewan healthcare system. We know that as the number of cases of COVID-19 rise in Saskatchewan, there will be some pressures in our healthcare system. And I want to assure the people that all of the necessary resources will be made available to support the diligent effort that is already underway. Not only to address the pressures, but to ensure that we are able to respond as quickly as possible to the needs as they arise. Saskatchewan's Emergency Operation Command has been activated for the last week to serve as a central point in coordinating the efforts of all public agencies in Saskatchewan during this response. Earlier today, Canada's premiers spoke with the Prime Minister, as well as Dr. Tam, Canada's Chief Public Health Officer, for a discussion specific to Canada's coordinated response to COVID-19. The Prime Minister provided some additional detail with respect to the $1 billion in funding that has been committed by the federal government to address this situation, including $500 million that has been earmarked for the provinces and territories. Of this federal funding, Saskatchewan will receive a per capita share of $15.6 million. This funding will be targeted specifically to support COVID-19 response within our health system here in Saskatchewan. In discussions with the Prime Minister, the premiers were asked to identify priorities and to address COVID-19 from across the country. Many indicated that this is a critical time for infrastructure flexibility as well as infrastructure funding. And the premiers also raised the importance of availability of supplies, which could include testing kits as well as personal protection equipment, or PPE. These are the areas that the Saskatchewan Ministry of Health and the Saskatchewan Health Authority are monitoring carefully, as there are other provincial health authorities with similar concerns across the country. But as a province, we cannot leave this effort solely to our health system to react and to respond as new cases may arise. We must take the personal and community responsibility that we know we need to ensure we are being proactive in preventing the spread of COVID-19 in Saskatchewan. So today, the government of Saskatchewan is announcing a number of aggressive new measures to prevent the spread of COVID-19 in our province. The Chief Medical Health Officer of Saskatchewan has made the following order pursuant to Section 45 of the Public Health Act, and it will be effective Monday, March the 16th. The Chief Medical Health Officer orders that no public gathering of over 250 people in any one room should take place. This does not include settings where people are distributed into multiple rooms, multiple buildings, such as schools, universities, or workplaces. The Chief Medical Health Officer's orders that no events with over 50 people, with speakers or attendees who have traveled internationally in the last 14 days, should take place. Retail locations and faith-based organizations are exempt. However, they should also have measures such as crowd size monitoring that support the safe social distancing that we have discussed, and should see guidelines from local medical health officer if they feel necessary. And effective immediately, people who have traveled outside of the province in the previous 14 days or who do have symptoms of acute respiratory or flu-like symptoms should avoid visiting long-term care homes and hospitals. In addition to this, the government of Saskatchewan, as an employer, is imposing a number of policies regarding government employee travel. So effective immediately, international travel, including travel to the United States of America for government employees on government business, has been prohibited. Any out-of-province travel for government employees on government business within Canada will be restricted and is subject to the approval of the Deputy Minister to the Premier. Any government employees who are currently traveling internationally, including to the USA, or plan to travel internationally for personal reasons, they will be required to self-isolate for 14 days after returning to Canada. This is a precaution. If they have or they develop any acute respiratory or flu-like symptoms, they should contact 811. All government employees who are experiencing symptoms of an acute respiratory or flu-like illness will be required to stay at home or to contact 111. While these measures are being implemented as a policy for the Government of Saskatchewan ministries, the Crowns, and the agencies, the Chief Medical Health Officer strongly recommends that all employers and individuals across the province follow these practices. This will help us limit the spread of COVID-19 in Saskatchewan. It will help to protect residents from exposure to the virus, and it will reduce the impact of COVID-19 on our healthcare system, essentially flattening the curve. In keeping with these new policies, Budget Day events on Wednesday, March the 18th, they will proceed, but they will proceed without the participation of invited guests. This decision was made after discussions with the Speaker of the Legislative Assembly. Members of the Legislative Assembly, media, and a limited number of staff will be authorized to gather for these events while also practicing social distancing. Further, after consulting with the Speaker of the Legislative Assembly, it's been decided that all tours and all public events at the Legislative Building are being suspended, and general public access to the Legislative Building is also being suspended. Our government is also taking measures to increase our capacity to handle COVID-19 in Saskatchewan. Concerns regarding the capacity of the health line 811 have been heard. Following an action plan ordered by the Minister of Health, the capacity of the health line, the 811 health line, has been more than doubled, effective as 9:00 a.m. this morning, with additional capacity that will be being added in the very near future. The Ministry of Health and the Saskatchewan Health Authority continue to work together to expand testing capacity for COVID-19, and that includes the introduction of a COVID-19 assessment sites across the province over the coming days. While these are significant steps that will help limit the transmission of COVID-19, most important is the responsibility that we all have to ensure that we do what we can to reduce the risk to ourselves, reduce the risk to our families, and reduce the risk to our communities. And the best way that we can do this is to practice social distancing, to wash our hands and wash our hands often, to avoid close personal contact like handshakes or hugs, and to self-isolate if we feel any symptoms of illness. So before I conclude, I would like to thank personally Dr. Shahab for his work and all of the members of the Saskatchewan medical community for their diligence in preparing for COVID-19 in Saskatchewan, and for their dedication over the coming weeks as we work together to prevent the spread of COVID-19. Thank you. Dr. Shahab.
Thank you, Premier. So I would just like to add briefly that I'll just speak a bit about our second presumptive case, and then just reinforce some of the comments that the Premier made about the enhanced preventive measures. So regarding the second case, it was a person in his 60s who traveled from Oregon State in the USA, arrived in Saskatoon March 10, and was not feeling well and self-isolated at home. So we don't expect a lot of contacts, and we want to reassure that public health is currently interviewing and following up with all contacts who need to be aware to self-monitor or self-isolate depending on their exposure. So we have now 2 presumptive cases, more than 300 tests done, and we are certainly, like the Premier said, ramping up testing where people have traveled from anywhere in the world, as well as people who may have gone to large conferences and events and may have any symptoms of concern. The second thing I'll just like to highlight is that we have a provincial operations center where all the sectors meet daily, and we have had one-to-one discussions with schools and universities. And while all sectors are making their own business continuity plans, at this point, there are no plans for school closures. But if and when that need arises, we will be monitoring this and connecting with our counterparts in education on a daily basis. If and when that need arises, that will be considered.
Thank you. Is there any questions? We'd be happy to take them.
How long is this order going to last? Any idea?
How long will the order be in place for?
So right now it has been put in till further notice. And obviously these are significant measures. They currently limit large gatherings. They currently limit people who have traveled from abroad. They certainly don't restrict day-to-day business. We will continue to monitor. If things settle down, obviously this can be rescinded. If things worsen, the order will be amended to bring even more restrictive steps like we discussed and like has happened in other parts of the world. So this currently meets the needs today, but we will keep monitoring the situation to see what adjustments need to be made in an ongoing fashion.
And there may be things that are added to this action as we go through the days ahead. And if we are able to get to a point where we look like we have hit our peak and are starting to reduce, then we would look at reducing items that are in this order and other actions that may be taken.
Adam?
Why the decision not to close schools? Manitoba has 3 presumptive cases. We've done this, and kids can't be expected to know social distancing.
So at this point, there are very strict guidelines for people who are coming back after traveling abroad, and that can include self-monitoring and also self-isolation in specific circumstances. That is an important first step. There is no evidence in Saskatchewan of community transmission. The other concern is that if you close schools prematurely for an indefinite period of time, children can still gather, for example, in people's houses while parents go to work. So we want to minimize social disruption. We want to promote as much social distancing as possible within the school setting, and we recognize that it is challenging, but we want to promote that for the time being. But if there was evidence of community transmission locally or province-wide, then further steps, including school closures, can be taken.
If there's only 2 cases and they've both had limited contact, why take these measures?
Well, the measures right now primarily address 2 things that are of concern in Canada and the US. One is they address importation of cases from anywhere in the world. And that has been an increasing concern because over the last 2-3 weeks, most of the importations have been from Europe and from within North America. So it addresses all travel, and that's very significant. And the other thing is that we have had instances now in Canada where there has been transmission in large conferences in both Toronto and BC. So that is not individuals within Canada traveling overseas, but going to events where there's lots of people from other parts of the world. So similar to cruise ships, large conferences seem to be a risk factor. So this addresses large gatherings and international travel for the time being. But of course, we will continue to watch the situation. And if we need to make further restrictions on group settings like schools, that will be considered.
There's things like that. I'm thinking on Costco on a given day, you're going to have more than, give that example, but you're going to have more than 250 people gathered in the store.
Yeah, so the time is being given for retail organizations to really work that out. And like we discussed earlier, there is ways to go into a large, retail organization in a safe manner. Shopping carts, other, automatically maintain that greater than 1 meter separation. And you just need to be more aware of what's happening and how you maintain that social distancing throughout your activities within a retail organization or other public gathering. So we think that this is doable. Obviously, even if we went to a stage where there were more restrictive measures like there are in Italy, even then grocery stores remain open. People do have to go out and shop in a controlled way. So that still will continue even with more restrictive measures. But right now, there's a lot of emphasis on social distancing in retail and other settings.
Dan, then Arthur.
Can you just elaborate on why this wasn't extended to public facilities such as gyms, schools, libraries, museums, where common touching would occur and not be sanitized straight after?
So I think this really sets the stage for all settings to consider what they can do to maximize social distancing measures and minimize transmission. And again, gyms and other places with where there's multiple touch services, you can use those settings in a safe manner with our current situation. But those settings have to make sure that there's after every use there's cleaning of surfaces, which people should be doing in gyms anyways, but just reinforces basic principles. But of course, the other thing that I want to emphasize is that if you have an underlying health condition or you are older, you yourself have to think about, should you go into certain settings where you may be at higher risk? Because that's another part that we all need to consider in terms of our own personal risk assessment.
Can you explain how this decision was made, Dr. Shahab? Was it something that you made purely on your own authority, or was there some political involvement either from the minister or from cabinet?
Well, there's several things. This has been discussed actively at the tables I sit on the Chief Medical Health Officer of Health. And actually, yesterday, there's extensive discussion on exactly these things, which include more enhanced measures for people who are traveling internationally. And just today, I think the federal government has also announced some significant measures on international travel. Secondly, as you know, we had been asked about group events. Other jurisdictions were being asked about that. So there was an ongoing risk assessment, which culminated in us and many other provinces over the last day or two coming to very similar conclusions to minimize transmission.
I would just, if I could follow up to that just a little bit, there is interaction between the officials across Canada and in Saskatchewan and the governments that are in place. I was just on the minister and I jumped on the operations call this morning with officials from across the province to first of all, to thank them and to thank them for what they have done and thank them in advance for what we know they are doing and continue to do. Second of all, was to reassure them that if there are resources that are required, that they would be there through the Ministry of Health, through the government of Saskatchewan. And I would just very publicly like to thank all of those involved in this response thus far. And again, just thank them in advance for what we know they are going to do. We then went to a call with the Prime Minister, all of the other premiers across the nation, as well as Dr. Tam, the Chief Medical Health Officer for Canada, where she provided us with an update, as well as some guidance on what we should and could be doing in each of our respective jurisdictions. For example, educating with respect to personal distancing, the personal responsibility that we can help educate the people of our respective provinces on. Some of the action that we can take, educating people on when and maybe when not to enter a long-term care home and ensuring everyone is, or a retirement community, ensuring the elevated level of risk that we have if COVID-19 should get into a populated care home where there are a number of elderly people. What we have done here is take the recommendations and support the recommendations, put the full weight of the government of Saskatchewan where we can behind the recommendations of the Chief Medical Health Officer, Dr. Shahab, here in Saskatchewan, when it comes to reducing the risk where we can. Reducing the risk with respect to the cases that we have in Saskatchewan are travel-related cases. We can correlate them to someone that has traveled recently, as well as to reduce the risk of having more community transmission, if you will, at large events, community transmission, if you will, at a number of different opportunities, I guess, if you will, across the province in our communities. So what we are trying to do is to reduce that risk. We can't eliminate the risk, but the other thing that people can do, each of us, in helping reduce that risk, is to practice our own social responsibility, if you will, in the way of personal distancing, in the way of, if you do have to go to the grocery store, and it is a large grocery store, to maybe take some wipes and wipe the handle of the shopping cart down, to take these extra measures that maybe otherwise wouldn't do, to keep your meter of distance between yourself and other shoppers. So some personal responsibility, if you will, that we're asking people just to be somewhat more cognitive of than maybe we otherwise would be. So we're trying to reduce the risk where we can from the provincial perspective, and that's on Dr. Shahab's advice. But there's also, we're trying to educate people and to ensure they're informed with respect to the items that they could do in their own personal daily life to also reduce that risk. And maybe before, at some point, I'd just like ask Dr. Shahab to maybe just run through again with respect to when and how you might request a test. As we are expecting there will be additional tests, as we now have 2 cases here in the province, there will be additional test requests. So when and how you would request a test, where you might go for that. And then 2, when and you would actually self-isolate, and what exactly the guidelines for self-isolation would be.
Thank you. So some of the questions that we are getting from Healthline and from employers are as under, and then just to clarify, once you come from an international trip, so first of all, now going forwards, we don't recommend that you travel extensively internationally. You reconsider your travel plans. But people who are coming back, as soon as they come, sometimes people think, if I get tested now, I'm fine, and that is incorrect. If you are asymptomatic, you should avoid large crowds. You should self-isolate if you've come from high-risk settings, and monitor your symptoms closely. In any case, for 2 weeks, you should only consider testing if you get symptoms. A test while you're asymptomatic doesn't mean anything. Secondly, if you're symptomatic, you should call Healthline, or you should call ahead if you have to go to see your primary care provider. Your primary care provider will either let you come to where he or she is, or will refer you to an assessment center. That way you minimize exposure to others. And similarly, for people who have not traveled, if you are feeling unwell, you need to self-isolate. Your risk is much lower currently, but we have instituted policies where anyone in a hospital setting who has an acute respiratory illness and another cause like influenza has not been found will automatically be screened for COVID-19. And similarly, we are still having outbreaks in long-term care facilities due to influenza. If an outbreak in a long-term care facility is not due to influenza or other respiratory illness, that will be automatically screened for COVID-19. So that's an extra layer where there's no travel, but we want to make sure, like the Premier said, that we prevent as much as we can this impacting the most vulnerable, which is the elderly, people who have underlying risk factors, people in hospitals and long-term care facilities.
Churches, mosques, synagogues, same thing? Churches, mosques, synagogues, are they like schools?
So again, social distancing should be practiced in every setting, whether it's a religious setting, a school, university.
They're not close as much.
They're not, and even in settings where we meet friends and family. I think that's really important, and I've already seen a reluctance to shake hands if you're meeting friends and family, some social distancing if you're sitting together at someone's house or at a social setting. So those principles apply wherever, in personal spaces, public spaces, religious gatherings, schools, universities. But certainly they can continue for the time being. The only exception is gatherings where people have come in from international destinations, and that should be avoided.
Karen and Sam.
I have 2 questions. Why not make self-isolation mandatory for anybody who's traveled, instead of relying on them to monitor themselves?
The self-isolation is mandatory for people who have come from high-risk areas or are close contacts. That is the recommendation for government employees, especially when you can work from home or have other means of working. There may be certain situations where it's not required, and you can self-monitor where you're not, working with large groups of vulnerable people. But self-monitoring is extremely important for 2 things. One is that at the first sign of even mild symptoms, fatigue, cough, you need to immediately self-isolate and seek advice for testing. And secondly, right now, this is for, primarily if you've traveled from abroad. But we know that if this starts transmitting at a community level, then you will have to self-monitor on an ongoing basis. So we all need to learn how to self-monitor, just like we do in flu season, and not go to school or work if you're sick. But we need to do that in a way that we absolutely, at the first sign of cough, and just cough even, we self-isolate and seek advice on further assessment. Data from Canadian cases shows that 80% of people have cough and no fever, 40% have cough and fever or just fever, and only 30% have shortness of breath. So just cough alone is enough for you to self-isolate if you have traveled from abroad within 14 days.
My second question relates to our smaller rural facilities. Are they able to handle people coming in looking for testing, or do you expect them to all come into the cities for that?
So far, the way testing has happened is that in the initial stages, we wanted to minimize exposure to anyone else, and testing was done in the home setting when we just had a few tests being required. Then testing, expanded. So in rural settings, if you call ahead to a primary care center or a health facility, testing can be done safely by you driving to a healthcare facility, going straight to a side room, not waiting in the waiting area where staff are expecting you, and the swab is taken and other assessments are done. In urban areas where the volume is increasing, that's where the need is for standalone assessment and testing sites that will take the pressure off, right to primary care clinics or other settings.
On that point, on the testing, we expect that there will be additional tests that will be requested in the days and weeks ahead, and with the $500 million that has been allocated by the federal government, and the $15+ million of that will be coming to this province. That's most certainly where we're looking at applying some of that funding is to exactly how we can enhance our test numbers here in the province, make them more available quickly and more available to all of the people in the province, not just in rural areas, but also in the larger centers as well, understanding there's multiple large buildings with a lot of people in them that maybe need to be tested at times in fairly short order. So that will be a focus of where some of that funding will go. And I don't know if you want to speak to any more in depth on that, Minister.
No, I think that summarized it.
Staff, Lisa.
Dr. Shahab, can you provide more details on these assessment centers? Apparently they're coming in the coming days. How many? Where? When are they going to be opening?
So our colleagues in primary care in the SHA are assessing the need throughout the province, not just in Regina and Saskatoon. They're looking at what the demands are currently, what they're projected to be. Right now, they're likely to be stood up within the days in Regina and Saskatoon. But throughout the province, provisions are being made that to make it easier for someone to be safely tested in a timely way, and even in a rural setting, by having a primary care site or a health facility during specific hours of the day, able to just screen people in a very streamlined way that does not disrupt other care. So those details will be becoming publicly available, and just to make it easy to get tested in a timely way.
The first assessment centers are likely to focus in Regina, Saskatoon.
Yes.
When are you expecting that they're going to be up, open, running?
The information I have is that they are being tried out as we speak to see how the process will work, because we want to make sure that what is the intake process? Is it you first call a Healthline and you're referred to a testing center, or is there a more streamlined approach? So those details are being worked out today. And so we expect them to be stood up either over the weekend or early next week.
I also wanted the language you're using is orders, no offense, over 250 or events with 50. Like, what teeth does that have? Like, what punishment could there be? What fine? Like, what if someone just doesn't listen?
So in my experience, for these kind of orders, public health orders, it's very rare for there not to be any compliance. But in case there is a lack of compliance, there are remedies under the Public Health Act and disease control regulations through legal channels. But the option was to make a recommendation or an order. The order is stronger, and it does expect compliance, and there can be remedies under the Public Health Act and regulations that may result in, penalties if there's non-compliance. But in our experience, there's a lot of social pressure to comply with these orders when they're enacted.
If I could, Stephanie, to your point, doctor's right. We expect that people are going to comply, but there are significant financial penalty provisions in the Act if it ever came to that.
Would you be monitoring, would you be, policing, or is it going to depend on someone calling and say, hey, I'm supposed to go to this conference, it's not canceled, what should I do? Or is there going to be a proactive monitoring of this?
So medical health officers are already fully engaged with large events that are being happening. And this is being done in a way to minimize disruption of events that can safely happen. Many outdoor events over spring and summer can still safely happen. Many things that group events where you can maintain social distancing can still safely happen. So I think we need to make sure that, some level of interaction, societal interaction happens in a safe manner. We minimize things where it's hard to maintain social distancing, like large events, and 250 seems to be a number that seems to be the cutoff. And similarly, but for situations where you have international visitors, the number is very small. And that's to minimize the number of people, even with social distancing, who inadvertently could get exposed if someone came in, was not self-isolating, and went to a meeting or an event.
Two questions. The first is just kind of a clarification. Would there were a couple of exemptions under the events? Would a wedding count as something that would be banned, I guess?
I think our recommendation is that any gathering be considered closely on how you can maintain social distancing. So obviously there can be many personal events in a house or a public space, but currently gatherings over 250 are problematic because you just can't maintain that. In an outdoor setting, you can maintain that level of social distancing. And obviously there's other events that are being planned, and they will all be considered on a case-by-case basis, that what's the setting, what are people going to do, can they maintain that social distance, that 1 meter separation, and if they can in a safe manner, they could go ahead, but if that can't be maintained, the recommendation would be to cancel. The second thing, of course, is who is going to be at those events. The criteria are very strict for international travel, but special considerations could apply for persons if it's going to be a gathering of people who are health professionals or people who are elderly or have underlying risk factors. Then additional precautions may apply. So I think this is something that we encourage anyone planning an event to discuss with the local medical health officer.
And there was just the other one. How do you know that there's no community transmission if you're declining to test people who haven't traveled or don't necessarily know if they've had contact with a confirmed case? Yeah, they test the same thing.
So at this point, the most efficient way seems to be to prioritize people who have traveled, because in Saskatchewan, the 2 cases were linked to travel. In Canada, the vast majority of cases still are linked to travel or close household contacts of those who traveled. So based on the evidence today, that is the recommendation. Having said that, there have been outbreaks in British Columbia and Washington State in long-term care facilities. So in those settings, we are going to test all outbreaks for COVID-19. And similarly, as an additional layer of protection, any severe respiratory illness requiring hospitalization is going to be tested for COVID-19. ERs are also going to have the ability to test anyone irrespective. So this way, the most severe manifestations, irrespective of travel, will be screened. But at this point, opening it up for everyone with a cough would really, I think, not be efficient in terms of screening out people who are at highest risk at this time. This may change based on what happens in Saskatchewan, what happens in Alberta and Manitoba, and south of the border.
Just to follow up on that from our phone call this morning, there's been in excess of 15,000 tests done across Canada with to date, I believe, 157 positive cases as of today. So there is a large number of tests being done. Actually, per capita, Canada has done a very significant amount of tests. So there's, at this point in time, it seems to be addressing any of the travel-related diagnosis that we're looking for.
Just one thing I just want to emphasize, sorry, was that testing is one thing. Self-isolation immediately when you're symptomatic is very important. It's not just relying on the test alone. Irrespective of travel, that is the other key thing that is really important. And I think that we really have to reinforce, even though we're getting out of flu season, that is the new normal for the foreseeable future. Immediate self-isolation when you have symptoms, and if you haven't traveled, wait for them to get better. If you have traveled, seek further advice for testing.
And it seems to me an example of that this week is the Prime Minister and his family.
So I have 2 questions. The first one, just focusing on this testing, you talked about efficiency. Would you be able to expand testing still further if there were more resources? I mean, is part of the limiting factor only having the one test kit available at the Roy Romano lab? Is there any thought given to expanding that testing capacity?
So right now, the testing volume is keeping up with the capacity of the lab to turn the test around same day or next day. There are discussions to establish additional testing platforms in Saskatoon, for example, as required. The efficiency really means that, for example, right now, if you have a busy family practice with 10, 15 people sitting in the waiting room, if you have a cold or cough, in many cases, you're asked to put on a mask and wait in the waiting room. We don't really want, it's disruptive for family practices if people throughout the day they come and say, I have traveled, I have fever, cough, then immediately you have to be self-isolated, tested, and the room has to be cleaned. And certainly don't want someone who's traveled with a cough to sit in a waiting area, because if the test is positive, everyone in the waiting area who are close to that case could potentially be contacts. So just to minimize those things, we are recommending the testing sites in large centers. In smaller centers, there may be primary care practices or health facilities that will just do assessment for travel-related fever for part of the day. So that is the streamlining part in terms of how the patient flow is, to minimize the exposure to others who are in a physician's office due to underlying illness and at higher risk.
Just on that as well, Arthur, on our call this morning, we discussed we've done just over 300 tests here in Saskatchewan. Other provinces have done in excess of 5,000. We're expecting, and we are keeping up with the demand of tests today. We're expecting that demand to increase, and we feel that we can access the resources in the way of the procedure and the kits. In saying that, nationally and internationally, they're very actively looking at what access they would have to different procedures and maybe different kits to expand that capacity, not just for Saskatchewan, but for all of the provinces and territories. So that work is going on a collaborative effort, if you will, across Canada. It was a topic of the discussion we had on the call this morning.
Just one thing I want to add was that, of the 300 tests in Saskatchewan, 2 were presumptive positive, the next were negative or had influenza or other illnesses. So even in influenza assessment sites, just because you've traveled and have a cough and fever doesn't mean you should all sit together. So even in those settings, you want to come one by one. So that's the other piece where you want to minimize exposure to most travelers with a fever, cough who actually don't have COVID-19. So even in those sites, that whole process is being considered very carefully right now about how to minimize exposure.
So just a few more details on the new assessment sites. Have you identified specific facilities in Regina and Saskatoon? What are they? Who will be staffing them, and how many people? And what kind of PPE will they be?
So the Saskatchewan Health Authority is working out those details, primarily for Regina, Saskatoon, but I have had discussions with colleagues in other parts of the province as well. The staffing is being worked out as well. Currently, the testing at the home setting was being done by home care or public health nursing staff. Medical health officers were also involved. In primary care, testing was done by primary care physicians and nurse practitioners. Obviously, in the hospital setting, testing is done by the clinician who's taking care, either in the ER. For personal protective equipment, like we discussed before, the Public Health Agency has issued infection prevention control guidelines that all provinces have adopted. They are consistent with the World Health Organization guidelines that clearly lay out the process, which really is, for all of us, there's no recommendation of mask use. It's Don't touch the surface and touch your eyes, nose, throat. Don't go out if you're unwell, cough in your sleeve. For a patient going into a facility, you may be asked to wear a mask, a simple procedure mask if you can tolerate it. For healthcare providers, assessing a person who has a cough and fever and travel, you are to wear a procedure mask and eye protection, gown and gloves. Assess. Donning and doffing is important. Studies have shown that where exposure happens, it's not because of failure of wearing a procedure mask and eye protection, is by touching the front of the mask and then not doing hand hygiene and touching your eyes, nose, and mouth. So just getting the muscle memory to don and doff properly. And then where in ICU, where aerosol, however, in the outpatient setting and the ER setting, the precautions are droplet and contact.
We got time for a few more questions. We've got Josh, Murray, Adam, then Roberta.
Just a few questions. Correct me if I'm wrong, but you said that these measures are in effect as of Monday when it comes to the numbers ban. Why wait till Monday when there's big events scheduled for tonight and this weekend in Regina and the rest of the province?
I think so. Events have been happening over the last week or being canceled. Already people have been adjusting what they're doing and not doing anyways. I think there's been a big change in how people plan events and behave at those events, and that's really good. But there has to be some lead in, especially for retail organizations and other sites, to think through and adapt policies and procedures. So this lead in is essential for them to be able to be ready by Monday.
And with all these cancellations and just like the flurry of news around COVID-19, there's obviously a more public sense of like the sky is falling. What would you say to people who just want to have some sort of normalcy in these weird times that we're in?
So this is what my message is, that right now our risk is low in terms of community transmission. But the risk can ramp up very quickly, as we've seen in other jurisdictions. And what we do today can minimize the risk ramping up quickly. Having said that, we need to understand that based on our current assumptions, this is no longer something that was limited to a few countries and only came over occasionally. This likely will become or has become a global pandemic. So, most of us over the course of the next year or two will get exposed to COVID-19. But it's essential that through all these measures and additional measures if required, we try to prevent the rapid escalation of cases. That is vital for us as families and communities, and that is essential for the ability of the healthcare system to cope with an increasing number of cases. So I think those are the planning assumptions and how we deal with this. And in terms of concern, we have to recognize that many countries have done studies on 80,000 plus patients. And we have to recognize that it's a very serious illness. But for young adults and children, they can be very efficient at transmitting, but the risk of serious outcomes is much lower. For older adults with underlying risk factors and seniors, the risk is higher. But even then, for people over 80, 85% actually get better. There is a high mortality rate for people over 80, it's 15%, much higher than influenza. But 85%, even in that age group, get better, but they must get the supports they need if their health conditions worsening. And similarly for adults 50 to 80 with underlying risk factors, the case fatality rate is much higher than influenza. It's between 5 to 8%, which means the 92% actually get better, 80% actually just by staying at home. Many of the cases in Canada have been in the older age groups. They've done well staying at home. But for the few who require a higher level of care, it is essential to get that in a timely way, and that results in better outcomes. So, and we want to flatten the curve. I think that is essential. We want to avoid as much as we can that rapid ramp up that has been seen in some jurisdictions.
I'm getting questions online that people are asking specifically to the hospitality and food industry. Restaurants, I don't think there'd be too many, but maybe food courts where there'd be more than 250 people. What about hotels and casinos?
So I mean, those are really important things, and I think businesses need to think through them. Medical health officers will be working with those businesses to really work with them to explain how they can minimize control crowding, first of all, and minimize the risk of transmission. But
The act states, sir, because I'm suspecting when the act was written, we didn't have to make 250 casinos.
well, it does not say especially to settings, but obviously large organizations like retail stores, for example, can have more than 250 people. But then it has to manage that you avoid crowding as much as you can. And some of it is something that facilities themselves organize. Some of it is how you stand in a line, for example, like in a grocery store. So again, those details, I think those are important considerations for those settings. But I think the details have to be worked out.
More on the social concern as opposed to owners dictating that I can only have 250 people in my store, I can only have 250 people in my casino, that kind of thing.
So this is not an airborne infection. So in a large retail organization, for example, you can have more than 250 people at any one time. You don't just want them crowding. And already the way a lot of these retail chains run, that is managed anyways. That's how the flow is. But it just some extra attention to that.
On that, from the other side of that, Marie, on our call this morning with the premiers and the Prime Minister and Dr. Tam, we talked one about the health requirements and some of the investment that the federal government has made, and some of the decisions that we were making as provincial and territorial jurisdictions across Canada from a health provision perspective, and from trying initiatives to try to flatten that curve. The second part of that conversation was to do with the impact on the economy and on people's wages, essentially. And the federal government had spoken to that in their funding announcement as well, in the way of EI benefits, as in the way of work sharing, supporting some work sharing programs. But one topic of that conversation was also businesses that are operating that would feel an impact of a global slowdown, and we've seen that in other areas of the world. But then two was self-employed individuals, as they often aren't in the employment insurance program or things of that nature. And so that's an ongoing conversation as to, one, what type of structure do we have to support those that may have to self-isolate for some period of time and might be a single or two-person show.
The best way to put it maybe is that you're aiming at crowds as opposed to crowded places, where you might be crowded in a casino or a retail store, but that's not a crowd unless it's somebody watching an event. 250 people.
Yeah, and you can clarify to this as well, Dr. Shahab, but what we're trying to do is take steps to reduce the risk. We can't eliminate the risk, but to reduce the risk, yes.
Crowded situations where obviously there'd be gathering more than 250.
Adam?
Yeah, we're hearing a lot of reports about 811 being overloaded, and I know there's been some steps taken to staff that a little bit more heavily, but the first part of the question is, if people are having trouble getting through to 811 and frustrated, what are their options? And just a follow-up to that is, I would anticipate that in the next few days, people who haven't traveled will start worrying about this while the weekend to think about it. Are there going to be measures in place to get people tested that maybe don't have a travel history, but are feeling under the weather and just want that peace of mind?
So the day by day, we're ascertaining things like who's being tested, our access to testing kits, things of that nature. And you may add to that, Dr. Shahab. On the 811 access, we have heard concerns with respect to people being on hold or drop calls. The minister has taken some very rapid action on ensuring that access to that health line is there. He has some results to report here this morning, and he will, and it's an ongoing effort as well to keep increasing the capacity of the 811 line.
Sure. Thanks, Premier. And then I'll see if Dr. Shahab wants to add, and to the rest of your question, Adam. We had some reports yesterday of people, first of all, waiting too long on line, and second, having calls drop, which was extremely concerning. I talked to senior officials yesterday at the SHA, asked for an action plan today. I've had a verbal update already, and I'll be on a conference call with them later this afternoon. We've effectively more than doubled the capacity right now. SaskTel's been called in to help. They work cooperatively anyway. Did a lot of work overnight overnight. The phone lines have went from 32 lines to 69 lines right now, and staff more than double as well. But we're going to add to that capacity too. Likely over the weekend, for surely next week, we expect that this is going to continue to grow. So we're going to keep adding capacity. Doctor, I wonder if you want to.
Yes, I mean, if you have not traveled, you still can talk to Healthline and express why you have concerns. Do you have a friend who had traveled internationally and was ill and never got tested and you're concerned? So I think it's still, if you have concerns, to have that conversation. But right now, our assessment is the risk primarily is to people who have traveled and their close household contacts. So that's what we're focusing on. But certainly, if things were to evolve, that recommendation could change.
Just quickly back to the 811. In terms of the call volume, do we have any sort of figures as to what we're dealing with to reflect why we would actually need to double capacity? Like how many did we normally get versus where are we now?
It's growing sort of exponentially, especially since the announcement of the first presumptive case. I don't have exact numbers for you, but we can certainly provide those. We just expect it to continue to increase. So we're going to err on the side of caution, and we can always scale back at some point.
We heard from the FSIN this morning on a different topic that they need support, that they're really worried about their basic healthcare capacity up there in rural communities. Can you tell us if there's been any sort of action plan laid out to tackle the rural and isolated communities in the province?
So that is of special concern to me personally. And we have been having for the last several weeks discussions with, for example, my counterparts, the medical health officers for Indigenous Services Canada and Northern Intertribal Health Authority, as well as my counterparts in Northern Saskatchewan and Central Saskatchewan and Southern Saskatchewan. So you're absolutely right. There has to be an integrated approach between primary care networks within the Saskatchewan Health Authority and First Nations. And we have to ensure that anyone in Saskatchewan, urban, rural, remote, on reserve, has timely access to guidance through Healthline and other professionals, has timely access to testing, either in their community or to a health facility which is nearby to them. And so, and lastly, I would say the mainstay of management has to be self-isolation if you're ill at home. And we have to make sure that that is possible and done in a safe manner, whether it's urban, rural, remote. That is absolutely essential for us to be successful in managing this. So those are important considerations, and we continue to have lengthy discussions on how that will work out in different environments. You're living alone, you have a small family, you have a large number of people living in crowded conditions. All those considerations are being looked at very carefully.
Thanks, everyone. That's all the time we have with Dr. Shahab. Doctor, you can leave here.
Yeah, I'll stay here. Are we staying? Yeah. Yeah, thank you. Appreciate it. I'll shake your hand. Thank you, sir. Thank you, everyone. He's busy today.
The Federal House of Commons is going to be shutting down. I was wondering if there's been any thought given to the potential of a hiatus for the Saskatchewan legislature.
We have had discussions on a number of different topics, but also whether or not we should close the legislature here. And we have came to the conclusion that we feel that government has work to do. They should continue to do that work. We should attempt to take every precaution, like we should across society, so that we are not spreading this virus. And so that's why we have taken the action of limiting the number of people that will be present in the building while we continue to function as a governing entity here in the province. This is a time I feel that we're the captains of the ship in many cases. So we feel we need to be at the posts.
What specifically was it that made you decide to not call a spring election?
Just that. not that I had made a decision to call a spring election, but I was open to considering the call of a spring election. I had not made that decision as of yet, but I was open to considering the potential of a spring election. But most certainly, this is not a time for a spring election. Many have alluded earlier in the weeks gone by, some in this room, that a spring election, should be considered. Many in the municipal world, many across the province. We were actively considering the potential for a spring election. But as we see things changing with respect to COVID-19 around the globe and across our nation, across our continent in particular, and even in our nation and now in our province, this most certainly is no time for a spring election. So I've clarified that although I had never decided on a spring election, I was contemplating it. I'm not now.
Well, you actually moved the date so that it was October 26th as opposed to November 2nd, I believe, to address the municipal election issue. So I guess we're wondering what other issues were in play. Was it the potential of a federal election? Was it political opportunity? What else was
there? Well, those as well as a number of others. Listen, we have faced some economic headwinds in this province. I've spoken to many of them. Some. And we just most recently in the last number of months, we have had rail blockades. We've had a rail strike. We have most certainly are going to have some economic fallout from what we see before us here today in dealing with a global pandemic. But this is, as I said, we were considering the conversation around should we call a spring election. We hadn't made a decision as to whether or not we were going to, but we're not doing that now.
Disputes up to and including what you may have to do with the co-op refinery seem to be an argument for keeping the legislation open. I'm not suggesting you're moving towards back-to-work legislation.
There's also some that would think there's a cause for the requirement for a mandate in some of that work.
Could you deal with those things that you just cited?
Pardon me?
You could not deal with the things that you just cited if there was an election campaign because Parliament, legislature would be dissolved.
You would deal with them shortly after an election campaign. Listen, and I'm not here to argue the semantics because it isn't happening. We were considering it. We hadn't made a decision. We have now. It's not occurring.
I want to ask what changed because 24 hours before you made this very clear decision, you said that you still were open to it. The WHO at that point had declared it a pandemic and still that wasn't enough for you to rule it out. Right. So what actually changed that you said, I'm going to rule it out?
We hadn't made the decision to rule it out as of yet, although we were talking about, whether or not this was the appropriate time to call an election, but we hadn't 100% ruled it out. So until we 100% had said we are not considering a spring election, I'm not going to come out and say what isn't factual. So I've been trying throughout these questions to be as factual as I can with the people of Saskatchewan through you when we were considering a potential spring election. We hadn't made the decision, but I was attempting to be as factual as I could. But as soon as we had ruled it out, I very quickly had stated that we were not considering a spring election. Sorry.
October 26th date now?
Pardon me?
Your note the other day said no spring election.
Right.
It did not commit to October 26th. And not to be one of these semantic guys,
right.
But after June 21st is summer. So I guess we could have an early summer election, couldn't we?
Right. Yeah, we're planning for October 26th. I don't know that something would precipitate us to go earlier than that, but we are planning for October the 26th. And saying that, with respect to, why we're not considering it now is because we are in the midst of a global pandemic that is affecting our province and our community. So we most certainly are going to be at our posts making the decisions that the people of this province expect us to do. Well, but in saying just that, and I believe Dr. Shahab, the Minister of Health, have also spoken to, we are making every attempt with some of the actions that are here today, as well as potentially additional actions in the days ahead, to flatten that curve, if you will, so that our health system can manage what's coming at it. We don't know what that looks like, and so we're trying on a day-by-day basis to literally to figure out exactly what those types of things look like. So all I can say to you today is we are intending to run the election on October the 26th.
Why did it take you so long? I mean, experts around the world and people within this province were saying that the COVID outbreak was only getting worse. And the morning it was declared a pandemic, you still didn't rule it out. So why did it take so long to reach a decision many saw it as kind of the rational correct decision to be made.
Right. So we had come to the decision shortly, before that, the evening before that. But with respect to that decision, it was something that was being discussed with respect in the days leading up to that. But until we make it, I'm not going to come out and then have to backtrack a number of days. I'm going to be entirely honest when I'm speaking to you and speaking through you to the people of the province. So once the decision to be made was made, I was entirely forthright with that as soon as we had made the decision. So, to answer your question, we hadn't fully made it yet.
Was the debate and the discussions around the spring election creating a distraction for you from planning for the COVID-19 situation? Because there have been
no, not for me personally. Listen, as Murray alluded to, there's a number of issues that we've been working on this spring. We have, a few labor disputes that we are, actively engaged in. We're bringing together a budget to release here next week. There's a number of issues that we are working on, and the conversation around potentially should we have a spring election. There's a number of factors that we've discussed that went into that. They're no longer relevant as we're not having one.
Just to be clear, what day, what time did you actually decide?
I don't,
No, I'm serious.
Finding out the COVID-19 case when you were informed of that on Thursday night, did that influence?
No, we made the decision actually previous to knowing. We've had a number of cases that have come through that we thought may be positive at some point. But even the very first case that we had, we weren't sure. I can't remember the exact times. We weren't sure, but we were making those decisions as it became closer, because we were starting to test more. It was becoming increasingly evident that this was going to be a significant challenge here at home, and that was in a large part why we didn't even feel that we should be considering a spring election at this point.
Question.
Yes.
Did you decide on Wednesday? Was that the final day that you decided no election? Because that's the day before you announced it.
So yeah, which day did we announce it? What day is today? Went Friday?
Yeah, you announced it Thursday morning.
So sorry, I've been around a bit here the last day.
Probably decided Wednesday that was the final decision was made?
It'd be Wednesday.
Did you know about the COVID-19 presumed case at the time?
I knew there was testing going on, and that wasn't the first time that some testing had went through, and they thought it may or may not be positive because of the travel history of the individual.
Confirms to you that it was a presumed positive before?
No, after.
Said he informed the government at the press conference yesterday. He said he informed the government the night before that there was going to be a presumptive positive. He had said that in the conference yesterday.
I wasn't aware of that.
I believe he said he was informed.
I wasn't aware of that.
Do you regret how long it took and the confusion that has been in the public and the speculation?
No, I don't think there has been a large degree of confusion in the public, because I've been entirely honest with each and every question that comes my way. If we're considering a spring election, I said that's what we were doing. We were considering a spring election. When we were no longer considering a spring election, I said we were no longer considering a spring election. So I haven't found that to be confusing anywhere, actually, except in the scrums that I've done on the topic. I've been out and about in some communities, and there doesn't seem to be any confusion with respect to election timing. But I can clarify if there is. We're planning for an election on October the 26th. Yes.
Sorry, you kind of made a joke about a cough and then getting tested. Is that strong leadership given the seriousness of COVID-19?
I think what you're seeing here today, and have seen in fairness over the past number of days, is in my view the best leadership that we are able to put forward. Whether or not it's strong leadership or desirable leadership, the people of this province will have the opportunity to judge that. What's that?
Taglines of strong leadership. So
Yeah.
I'm wondering if joking about a pandemic and getting tested is strong leadership.
I think I made a joke with respect to self-quarantining on the stage. Listen, I was in the middle of a 30-minute speech where I had a frog in my throat. I made a small, statement, if you will. I believe if you look at my speech in its entirety and the action that we're taking today, I believe we are putting forward strong leadership on behalf of the people of this province, and we're going to ask for them to provide us with the opportunity and the honor to continue it for 4 years.
Couple last questions.
Conclusion that this was a serious pandemic, I guess, in terms of I think it's something we've all struggled with in terms of how to measure, how to react, and how seriously. But when did you come to the, I can't say the word, but holy moment,
I don't know if there has been a holy moment. As we discussed election timing, I think your percentages as to where you sit on that decrease over time. But until you make the decision, I can't go out and say that the decision has been made. With respect to the pandemic, even on our call this morning, as the provinces provided updates from their respective regions, we heard time and time again how this has changed over the course of the last 3 days, and how it's even changed this morning on an hour-by-hour basis, with provinces reporting increases on an hour-by-hour basis, even as they move through the hours this morning. So, our environment with respect to working through this pandemic nationally and in our provincial regions and even in our communities is changing by the day. That's why our operation calls have gone to daily updates, updates to frontline staff, to those that are providing the service across this province, to disseminate facts and to disseminate the information, contact information that they require. That's why we're updating our website on a frequent basis, is so that we can disseminate as much in the way of facts as we possibly can. So I don't think in light of the changing situation that we have, and it's going to continue to change and likely will accelerate in the rate of change that we see, not just here in Saskatchewan but across the nation. We need to be ready, and that's what we are.
An awareness session, I think this, as I say, it's remarkable how the world has changed in a week. I assume
3 days, I would say.
Yeah, I assume there's a point where everybody sat down and said, no, we have to take this in a totally different light than we've been taking it before. Did that happen sometime for the government this week?
Not at one point in time. There's a number of different people that I listen to across our caucus, and in fairness, across the province as well. And that is precisely what we're here to do.
Do you have? I mean, it seems like everything has sort of come together here all at once with what is a much more ambitious plan that was in place just a day ago. Are you totally satisfied with how quickly the government moved on this? That it happened?
The government's been preparing for this for some point in time. That's been no secret. Dr. Shahab, the Minister of Health, the Ministry of Health, the Saskatchewan Health Authority, they have been preparing for some time. These operations calls have been occurring for a little over a week now. So the preparations have been ongoing, and they are intensifying certainly as we're being impacted here in Saskatchewan. I would note, from the operations calls that we're conducting, there's different people on the calls, but these are the very similar types of informative calls that we would put together during a time of flood, during a time of forest fire, to disseminate that information to those that need it across the province, and to do it quickly. They've now since moved to a daily basis. That's a good thing, and they're expanding who is on the line. So you're seeing it intensify, I think, because of the impacts that we're seeing in the province now.
It's criticized by the SHA as disorganized and confusing at certain points.
The SHA has been criticizing?
Sorry, not the SHA. I mean, Sun.
Oh.
And I'm just wondering if you
I didn't see that criticism, so I apologize. But
I'm just wondering if there's anything in your view that the government could have done to get ahead of this more quickly.
Oh, I think the Saskatchewan Health Authority, the Ministry of Health, Dr. Shahab and his team, they've been doing everything they possibly can. They've been talking to the people through these operation calls, and otherwise through today, through this opportunity to use the media to get the message out, get the facts out to the people of the province. They've been doing a remarkable job, and I have every faith in officials here in the province, and not only the work that they've been doing, but the work that I know they are going to do in the days and weeks ahead. And we are going to fully support that work. That is precisely who should be doing this work. And I can say as well, they are engaging across the nation. And we were on a call here this morning. Dr. Shahab co-chairs the National Health Organization right now. Saskatchewan is a co-chair with the federal government. So it's Dr. Tam and Dr. Shahab that are actually co-chairing those meetings as well. So Saskatchewan is very plugged into what is happening across Canada. They're taking that information and applying it to how we can be best prepared here in Saskatchewan. So I commend health officials for their preparedness. I commend them for the work that they've done, and I thank them in advance for the work that I know they're going to do.
Josh, we got a last question.
With you still planning on tabling the budget next week, has that budget changed even within the past 24 hours? And the budget that you have laid out today, do you have confidence that it will stay the same or change within the next 3 to 4 days?
Well, when you look at the changes that are occurring right now let's just take the TSX for example, they're large. They're very, very large. They're very, very abrupt, and they're happening in stock markets. They're happening in commodity prices, and I guess the part that nobody knows is for how long they will exist, how long these downturns will be there. Will it be a few days? Will it be a few weeks? Will it be a few months? But we are going to table the budget that we have because we feel it's the right budget for Saskatchewan. And in that budget, you are going to see us investing in building our province. There is going to be, in addition to the health needs that may be coming at this province, and those will be funded. There will be economic fallout in the weeks and months after this budget, economic fallout that will already build on, as I said, rail blockades and other challenges that we have had here in the province over the course of the last number of months and, quite frankly, a couple of years. So you're going to see a budget that addresses some of those challenges that we have. You're also going to see a budget that most certainly, I would say, is going to ensure that we can fund any of the health needs that may arise from COVID-19. We will also then be updating that budget, obviously at Q1, or potentially even earlier than that, to keep the people of this province informed with respect to how long some of these economic challenges, economic changes actually are going to impact our budget. But rest assured, we'll be keeping the people of the province updated on that. So we know what has happened, for example, with the markets. What we don't know is how long they're going to be impacted.
So discussions with all the stuff going on in the markets and everything, has there been discussion to change some things of the budget?
The investment in this budget, both the capital investment and the investment in people and services, is large. So, and we'll see more with respect to that on Wednesday. So much of the services that will be required will be addressed just through traditional investments that we have made, and then some of the increases and the additions that we will see on Wednesday. If there needs to be changes to address the health outcomes that we may be challenged with, or to address things that may arise in the economy, as well as we are always promoting the expansion of our economy. We will discuss, as they arise. But right now, we are going to introduce a budget. We don't see a need to make, massive changes in the budget, but we will most certainly, because of the way that we have formulated this budget, but we most certainly will keep the public apprised of any challenges that we may see on the revenue side due to if there are some lingering effects in the markets, as well as if we need to change any on the investment side, we'll be keeping them apprised of that as well.
Is that $15.6 million that the federal government's giving to the province to help fight COVID-19, is that going into consideration with the budget?
Well, that's come in after the budget. I'm not certain that would be. I'd have to check. I don't know the answer exclusively to that particular question. But there is other funds available in the announcement the other day. Most notably, I would say some of the research dollars, the $275 million of research dollars that have been provided. And so we've been in contact with the federal government. Is there opportunities for us to partner, if you will, on, partner with existing organizations here in the province that could, advance some of the vaccine research, for example, advance some of the vaccine production, for example. So those are very active discussions as well, with not just the $500 million arriving, but some of the additional dollars around that make up the total $1 billion.
Murray, last question.
Adam? You have a big social media following. Your team's pretty active on Facebook and Twitter, and there's a lot of misinformation out there. There's a lot of people that are downplaying COVID-19. Are you planning on using your platform to let the public know and keep the public abreast of the situations in the next few days?
Yes, I will, and I'll use every platform that we have. As Dr. Shahab had said, we are currently in this province at a low risk for, in particular, community transmission of this virus. But where we do need to be careful and be vigilant is in the case where people are returning from overseas, in particular returning from areas where COVID-19 is evidently present. So in those cases, we need to take precautions. We've talked about some of those precautions here today with if you do feel the symptoms coming on, that you self-isolate and immediately call 811 and request a test. But most certainly, what we can do here as a province with some of the recommendations and some of the orders that have been put forward, avoiding large congregations of people, self-isolating if you feel the symptoms, those will reduce the risk that we have in our society, but there's also some personal responsibility that each and every one of us has in the way of personal distancing, in the way of cleanliness with our hands, with where we're touching, in the way of, for example, when you're shopping, to just use a wipe on the shopping cart itself, to not shake hands upon a greeting. And this is a little bit of a change for us, but it's incumbent on each and every one of us. And I already have done some posts with respect to social distancing, at least for the foreseeable future, to take some of our personal responsibility very, very seriously. I know I've talked to people just in the course of the last day or two, which speaks to how this has evolved, who are changing their travel plans quite significantly here this spring and even into next fall.
Thanks very much, everyone. Thank you.
Thanks, Jack.
Thanks, Adam. Yep, take care.